Hi, this is Jen Kay, and I'm here at the Arizona Natural Health Center in Tempe, Arizona. I am so excited and honored to be hosting this segment of natural remedies for common and sometimes not so common conditions. Today's segment focuses on migraines and headaches and how some of these common conditions can be treated naturally using a whole person approach. I have the honor of introducing you today to Dr. Udell, one of the amazing and extremely talented doctors here at the Arizona Natural Health Center. Dr. Udell, welcome.
Thank you, Jen.
Glad to have you. Especially considering you are a doctor, an instructor at the school, a full-time dad, full-time spouse. My Lord, migraines and headaches, do you ever get those?
Fortunately not.
Yeah. You take your own advice, right?
Absolutely. But I've had a few myself, so I understand.
So you can speak from experience.
Absolutely.
Well, great. So here's a question for you. We talk a lot about migraines and headaches. What are the differences actually between migraines and headaches, and what are some of the common symptoms that people experience with them?
So really, migraines are just a type of headache, and so we classify headaches according to the symptoms, and sometimes those categories aren't perfect, but they give us more or less an idea of what type of headache we're talking about, and that helps us understand more what to expect from the headache. So migraines are typically more severe headaches that happen repetitively or recurrently. So people get them usually in attacks that can last anywhere from a few hours to even a few days if they're real severe. And though there's lots of different symptoms that are part of migraines,
sure,
some of the most common are throbbing pain, light and noise sensitivity.
Is it light and noise sensitivity?
Light and noise sensitivity.
Okay.
Light and noise sensitivity.
Yeah.
Nausea or vomiting. And with some people, they may even get visual disturbances, numbness and tingling, and even difficulty speaking, quite like myself, right before a headache starts.
That sounds extremely uncomfortable.
Very much.
Tell me then, based on some of those different systems, are there different triggers for migraines or headaches?
There are. Not all people with migraines can identify the things that trigger their headaches, but there are a number of different common triggers. Some of the most common are fatigue and lack of sleep, which of course a lot of us can identify with.
Sure,
of course.
Absolutely.
Emotional stress is another common trigger. Anxiety, worry, anger, kinds of things that can trigger migraines. Even excitement, even getting overexcited about something good, if you're prone to migraines, could be triggers. And there are a number of different foods and chemicals that also can trigger migraines as well.
So even when you say foods and chemicals, if a person has a food sensitivity, or Dr. Haller's mentioned if you have certain chemicals or toxins in our foods, that can express itself in a migraine or headache. Is that correct?
Absolutely. Someone who's actually susceptible to getting migraines may have certain foods that, although there's nothing innately wrong with the food, for them that food tends to trigger a migraine.
From a personal perspective.
Absolutely.
Very, very interesting. So once someone recognizes or has a diagnosis of a migraine or a headache, what are some of the treatments that people can actually go to for that?
Well, conventionally, the way migraines are treated are with drugs. So there's a couple different types of drugs that are used. Some are over-the-counter, some are prescription. But the most common types of drugs used are drugs that are used to actually try to get rid of the migraine pain once the migraine begins. There are other drugs that are used daily to try to prevent migraine attacks from happening, and those drugs may be used when people have more severe or more frequent migraines.
So that's a conventional approach. And when we talk about some of the drugs, either for symptomatic or prevention of migraines or headaches, so often we hear that those drugs have all of these side effects. I mean, any commercial, you've got half the commercial is spent, with the side effects and what have you, which could potentially contribute to more migraines and headaches or other health issues. Is that right?
Well, it certainly could contribute to other symptoms. In other words, some of these migraine drugs definitely produce side effects. Some people are more prone to side effects. And so sometimes people are trying to treat the migraines, but then they suffer from side effects that are also quite bothersome.
I see. So that being said, though, here at the Arizona Natural Health Center, you have a much different approach to that, correct?
A much different approach.
Oh, wonderful. I really want to hear. Tell me, please, about what your approach is here.
So our primary approach here at Arizona Natural Health Center is the homeopathic approach. So we use homeopathy to treat migraines, sometimes in addition to other natural treatments. But the homeopathic approach is really quite different. With homeopathy, what we're trying to do is to encourage the body to heal itself and eliminate the migraines using really small doses of natural medicine. So essentially, migraines are caused when certain areas of the brain become overactivated, and it causes just a series of events that produce the migraine headache. What we're doing with homeopathy is we're trying to sort of induce the body to regulate itself properly again, just like it would in a person who doesn't get migraine headaches,
Sure.
so that the migraines over time disappear and stop happening.
Because not everybody has migraines.
Not everyone has migraines.
And the human body is pretty incredible at healing itself.
Absolutely.
It seems so natural and makes so much sense. But you know, I know this certainly works from personal experience. At the same time, I know what's on the minds of so many people is, well, that's all fine and good, but does it really work?
The answer is yes, for sure. I don't have to hesitate in saying that. You know, we treat lots of people with migraines, and not only migraines, but all types of other headaches, cluster headaches and sinus headaches, and there's a whole variety of headaches. And people who suffer headaches suffer, and that's the bottom line. And we have great success with them. I can think of, you know, many examples. You know, one that sticks out is someone I've been working with recently. Is a woman named Ella that has been suffering terrible, terrible headaches. When she first came to see me, she was having headaches daily that were so intense that it took, you know, every bit of strength for her to get through her days. And then she would just dread the nights, because often she was woke from these terrible headaches and up for several hours and exhausted the next day. And her headaches were just violent. I know another way to describe them.
I just want to hold my head. They're violent.
Absolutely, just debilitating. And you know, she tried lots of things to deal with them. She was in the emergency room twice because of the severity of the headaches, and one time was actually kept in the hospital, and was eventually prescribed some medications by a neurologist, which did in fact help to reduce in some degree the severity of the headaches, but it didn't eliminate the headaches, and over time they continued to get worse. So in her case, what we did is we understood what was going on with her, specifically her symptoms, those things unique to her, and I prescribed a homeopathic medicine named Spigelia, which she began to take. And a few days later we spoke, and she told me she was doing wonderful. She was already noticing a decrease in the severity of her headaches, and they were no longer happening every day. And over the course of the next few months, we've essentially eliminated her headaches entirely, and she's no longer having headaches.
Oh my gosh, that must be so emotionally freeing when you're not constantly in pain.
Can you imagine?
I'm telling you, what a wonderful success story, and I'm sure that we could sit here for the rest of the day and I could ask you questions about more of your patients and their success stories. You know, let me ask you this. So then if I had, you know, someone that I love, right, was really suffering and had these chronic headaches and ongoing experiences, or, you know, if I did one day, would it be as simple as coming to the Arizona Natural Health Center and just setting up an appointment, or are there things that they can do on their own?
Well, certainly in order to do the homeopathy and some of the other treatments, the best way is to go and see one of the doctors who can actually work with you individually and create an individual treatment plan for you. But before then, there's things you can do on your own. You know, some of those things have to do with avoiding or eliminating the triggers for headaches. So first of all, get plenty of sleep, because we know sleep is a trigger, and for so many of us it's easy to lose sleep, so we have to make it a priority to get a normal amount of sleep.
Sure.
And if sleep is something that's a problem itself, then that's something that needs to be addressed as well. In addition, stress management. You know, I said that emotions can trigger migraines, and even though for many of us we can't eliminate the actual things in our lives that stress us, or at least not entirely.
Get rid of half the people in our lives, right?
Absolutely.
Yeah, okay.
You know, get rid of our job, go on vacation.
Sure.
But not realistic, of course. But what we can do is we can change the way that we react to those stressors. And so there's a variety of techniques. Some of the ones we know about are meditation, guided imagery and visualization, deep breathing exercises. There's a number of them, and there's lots of resources out there to get started right away with those kinds of stress techniques. And then, you know, finally, I'd mention, you know, any foods or chemicals or other environmental factors that you're able to identify, or even that you're suspicious may trigger your migraines. Try eliminating them and see if you get fewer migraines. Those are things you can do right now.
So, you know, oftentimes people are not necessarily aware. So you would suggest in the case of like food or environmental factors, just maybe even increasing their awareness of, okay, when I do eat these foods, you know, and kind of tracking maybe when those symptoms start to come up.
Yeah, and one thing people can actually do for themselves is they can create what we call a headache diary.
Okay.
They can actually start to keep track of their headaches and actually keep track of, you know, what did they eat that day before the headaches on the days that they get the headaches? You know, when did they get the headaches? And by actually just keeping a daily log and noting when they get a headache and when the headache occurred and what else they did that day, sometimes they're able to see patterns and identify some of the triggers that they weren't aware of before.
What a great idea. That is fascinating. Just something that simple, just track it, you know, what you're eating, what you're feeling, what's coming up, and when it comes up.
Absolutely.
And that's something that's so simple people can do on their own,
They
right?
can do on their own right now.
Dr. Udell, I have to thank you for sitting down and talking to me and everyone watching this video about migraines and headaches and some of the natural things they can do in their lives on a regular basis. Thank you so much.
Oh, you're welcome. Thanks for having me.
I hope you have enjoyed our segment on migraines and headaches for natural remedies to common and not so common conditions. I'm Jen Kay, and on behalf of myself and the doctors here at the Arizona Natural Health Center, thanks so much for watching. I highly suggest that you watch some of our other videos in this series so that you can learn more about how natural remedies can help you and how you can benefit starting in your life right now. Thanks for watching. We'll see you soon.